When phoning a patient, the conversation might go something like this. Hello, Mr. Smith. My name's Toby Richards. I'm one of the other doctors at your hospital. I'm a colleague of your surgeon, Dr. Brown. There's no problem. We're just phoning you because we're conducting some research and we were wondering if you might be able to help with us. I'm just phoning because we're conducting some research at the hospital and we are I'm just phoning because we're conducting some research at the hospital and we were hoping you may be able to help us with this. As part of your operation, you've had some blood tests recently and it's been found that you're slightly anemic. You may or may not know that, at which point the patient might respond and say often that they had no idea they're anemic. Well, you are slightly anemic, and what this means is that you're more likely to need a blood transfusion when you have your surgery. This is not a major problem per se, but one of the things we're doing is we're looking at treatments that we could give you for your anemia now to see whether or not that reduces the need for blood transfusion. We don't truly know whether or not this treatment works. It's also relatively expensive. And so we're testing this in a formal clinical trial in the NHS. Having spoken to your surgeon, he's put your name forwards to be selected for this trial, and we were wondering if you'd be able to help us with that. So in saying that, there's a couple of things that I've added in. One, that the surgeon, their surgeon, knows about this trial. Secondly, that the patient has been selected rather than is appropriate or could be included. And the most important thing is I've said to the patient, I've asked the patient, will they be able to help us? Because they will be helping us with research and they'll be helping others in the future.